and welcome to the Sunday special that we have on Let's Talk Stroke. Today's guest is Lindsey Unger from beautiful San Diego. Now, Lindsey is a speech-language pathologist, so let's just bring her on right now. So here she comes. Welcome.
Hi, thanks for having me.
You bet. How are you?
I'm doing very well. How about you?
I'm doing terrific. Happy Sunday.
Thank
And now I just want to make sure you could see the comments.
Yeah, I'm seeing them pop up. Yeah.
Yep. Salute from Inglewood, California. Nice to see you.
Sunny San Diego, that is for sure. It's really nice here.
Yeah, that's where my son lives there. And but yeah, so how are you?
Everything's going very well. The pandemic closures, they don't seem to be quite as strict right now. So here in our community seems to be going pretty well. Wow. I'm hoping it stays that way. It's pretty scary for everyone.
Yeah. Oh, I know. It is absolutely crazy. It's right. Now, are you doing your therapy? Are you working out of the house? Are you just doing teletherapy? Are you working at the hospital, or are you going actually UCSD? UCSD.
Right. So I work at UCSD. I am full-time over there. I'm there at the clinic that we have. It's a rehab clinic, a little separated from the hospital, but still on the hospital campus.
Right,
and
right.
We do kind of a mix of in-clinic visits and telehealth or video visits right now to keep it so that it's not too crowded in the waiting area, and we are mindful of social distancing and all of that.
Right, right. Now, which probably a lot of them, most of them that are watching know what aphasia is and all that. What exactly is a speech-language pathologist?
Sure. Okay, so a speech pathologist you can find in so many different settings. And what I do as a medical speech pathologist is we can work on speech, voice, swallowing, cognitive communication disorders. There are so many different things that come across our caseload, and kind of different if you're in the inpatient side versus the outpatient side, like where I am. On the inpatient side, you would be working a lot on swallowing. So you might, after a stroke, see a speech pathologist come across your door in your hospital room to assess your swallowing and make sure that it's safe for you to be eating and drinking and taking your medications, and that you're managing your saliva given the medical situation that you're in. If someone has a trach, then we might be working with a speech pathologist there and helping you wean from the ventilator and get your voice back and get your swallow back. Cognitive communication or cognitive linguistic skills are often assessed in the hospital setting to make sure that you can make your decisions about your medical care, to make sure that you can communicate your needs, to make sure that you're able to kind of comprehend the information coming at you. There are so many different things in which we're involved in that hospital setting, but also on the outpatient side, kind of transitioning to like, okay, what's functional for your everyday life and how do we get you back to where you'd like to be? And yeah, it's a very complex field and kind of multifaceted in that way.
Right. And do you work with a team?
I do currently work with a team, and under the umbrella of rehab, we have our physical therapists, we have our occupational therapists, and then me as the speech therapist. And we're all neuro kind of centered care at our facility. So anyone with a neurological condition would come across into our clinic.
Wow. And you're one of your fabulous patients here, Don Ogan. And first of all, thank you. Friend of mine, thank you so much for working with him, because he speaks highly of you, and I, we talk quite a bit, and so thank you for working with him, because his speech is it's changed quite a bit.
Right. I think Don is a really excellent example of how speech therapy can help improve somebody's quality of life, and kind of stick with the program and what that can do for you. So he's a really great person to communicate with, and his experience with speech therapy.
That's terrific. I know that, well, I think I told you before, what I get little, well, for me concerned when I went through speech therapy, and I guess I didn't know I had a problem with it at that time. And so now I'm working on my physical and my occupational, and I'm not working on my speech therapy. And my wife's even telling me I'm getting worse now because I don't do anything with that.
Right. You know, during our side conversation, we had talked about how frustrating speech therapy can be at times.
Yes.
And making it relevant and interesting is something that as a speech pathologist, we always try to do. What you enjoy and what's relevant for you is helping other people and public speaking and helping other people find the resources. And I think that's your therapy, that's your version of speech therapy that you found for yourself. It may look a little different from what you normally think of as speech therapy.
Yeah, it's true. And I can actually see myself getting worse. I mean, that's why I'm working on it every single day, trying to talk. I don't know if that's normal. Should I be talking slowly? Should everybody be talking slowly, more slowly?
Yeah, I think that definitely working with a trained speech pathologist would be recommended for anyone that is having some struggles with their speech or cognitive linguistic skills or swallowing. But in terms of speaking slowly, we can kind of take it a little too far in terms of the slow rate of speech.
Right.
And if we take it a little too far, it's can be really hard for that listener to keep up.
Right, right.
And to kind of comprehend everything that's going on. So, but yes, I do think that kind of going at speech a little slower than what you may be used to is a great way of going about things to get your communication out a little clearer.
Okay, okay. And you know, you're in the neuro of speech pathology, right? And how did you get into it? Because it's kind of curious how you got into. How do you get into? Because I love therapists, all of them. Because you don't realize what you all do until you need them.
Right. Yeah, it's taken me a little while to find, you know, where I fit in into the field and finding my little niche, but I have definitely found it and where I thrive the best. My journey started back going through college. I kind of misguided and ended up going into liberal studies and then found teaching, and then there wasn't a whole lot of passion behind it though. And it was teaching for elementary school. So I was going through the motions, and you know, kids are awesome, but it didn't give me the sense of fulfillment that I would have hoped. I did have these kiddos in the classrooms during my clinical experiences in the teaching program who would go off to their, you know, speech therapy room, speech therapy class during the school day. Right. And I'm, you know, kind of wondering, oh, what are they doing over there? I might as well go observe and see what's going on. So after observation, after observation, after observation, I found it. I found what I needed to do for the rest of my life. And funny enough, that was working with kids. That's the amount of passion I felt just watching speech therapists work with a child. So I ended up taking a few classes in speech therapy, ended up really loving it, the anatomy portion especially. Right. Completely flipped and got a master's degree in communication disorders. Was lucky enough to end up at the VA system for my internship. And through the VA system, you're able to see pretty much everything. And it was a wonderful clinical experience. They hired me after my internship had been completed, and I stayed there for about 8 years.
Oh, wow.
Being trained in so many different aspects of our field. And that's a wonderful teaching facility. You can just about see anything and everything. Found my love for working in neuro, Parkinson's disease, movement disorders, stroke.
Oh, wow.
A great clinical experience all around until we ended up moving here to San Diego, which has just been such a blessing for our family. And found my wonderful job at UCSD.
Love the school there. So Marina's asking, does reading out loud help? Right.
I definitely think reading out loud helps. You're going to have to kind of find what works for you. So keeping it relevant, like you and I talked, like doing this show is relevant and interesting for you. you find
Yes.
it is helpful in kind of your own self-therapy. If reading is something that you really enjoy, reading out loud is a wonderful tool to help gain communication back, right?
Right.
The complexity of what you're reading out loud, kind of looking at what are we able to manipulate the text so that you can see it clearly? What is the interest? Is the topic interesting enough for you to keep going with it? I think is what we should really be knowledgeable about.
Right. And Dawn here. How are your kids?
My kids are good. I have a 2-year-old and a 4-year-old, so they're at mother-in-law's right now.
Wow. Yeah, I'm going to bring up some of the comments here just to, salutes liberal studies, K through 12. That's her passion. And Lori's saying, wow, 8 years at the VA.
Yeah. What an awesome experience working at the VA system is, and unbelievable how rewarding it is working for our country. Is pretty much just one of the highlights of my life. And I loved it over there.
And Mike Peters. Okay.
Just not felt for what my wife said. Yeah. So that kind of makes me think a little bit. Okay, what does the speech therapist do? We talked about, yes. Someone might come across our door in the outpatient setting, and they're like, why am I here? I don't have a problem with my speech. And so we've talked about how multifaceted the field is, and we may not just be working on speech. You may have been sent to a speech pathologist for a completely different reason. So, in terms of what the referral was for, we often have to tease that out because sometimes the doctor doesn't know. They may just kind of refer to speech. We think speech needs to be involved. We're not quite sure. And the patient may not know either. So our job is to kind of tease out and fill in the pieces of the puzzle to make it all make sense. There could be a multitude of reasons after a stroke why someone would need to see a speech pathologist to help you get back to independence, get back to work, get back to school, get back to being a functional human being.
Yeah, and this is this comment here. I had this a little. Sometimes Mike struggles in a crowd, and I know he's saying a lot of times there's many conversations going on, and you're in a conversation, and then I can't, because I'm all distracted.
Yeah.
Do you ever hear that?
Right, I hear that a lot. I think when you're talking with someone who has aphasia, what's really important is I have like a do's list and a don'ts list for talking with someone who has aphasia. And part of the do list is making sure you connect face-to-face with someone. And it's really hard right now because we have masks on, right?
Yeah.
And it's hard as a speech pathologist providing speech therapy with a mask on. And if you're in a group conversation right now, hopefully you are wearing a mask. But get that person's eye contact, be face-to-face with them, and be as close as you possibly can while social distancing. And using a lot more than just verbal communication can be very helpful. Be able to use gesture, body language, different facial expressions that can be seen through a mask. And if it comes down to it, even like writing a few different things out if somebody really can't comprehend.
Right.
Another thing that can be very helpful is take that conversation into like a side conversation in a different part of the room to reduce noise, because noise can be very distracting. Conversation is a focused attention task. And if that focused attention is already impaired for whatever reasons, multitude of reasons, we have to take away as many of those environmental factors as you possibly can and take that into a side conversation where you can be more face-to-face and kind of mute environment noise. Yeah,
because one of our news reporters has a mask and it's clear, so you can see her mouth move to understand her.
Right. Very helpful.
Yeah. Let's see. So Tom salutes a caregiver and her husband, Tom. the original one-word wonder. Aha. There's some other ones here before we ask. So there's a big one here. Tommy, I don't know if you could read that.
Yeah, still learning on this. I've gotten much better. The words are there and can't come out and just stutter enough until I get, okay, got it.
Totally understand that.
That's really hard because oftentimes with aphasia, like you have this idea of what you want to say in your head, but then sending that information to your mouth and making your mouth do what your mind wants it to do can be a very tough thing. So like you said, going through things a little slower, sorry, morning voice, might might just be the case. But you know, kind of putting together little conceptual ideas like, okay, here's the keywords of what I want to say, and then I'm going to see if I can come up with like a noun phrase and a verb phrase and ultimately combine it into a short, little concise sentence. Would be more than just kind of pushing something out. Whatever comes out, comes out. Kind of hold yourself back a little bit. Take a little extra time to process and think. A little extra 5-10 seconds isn't going to interrupt the smooth flow of conversation too much. We can take that time and pinpoint a couple of little key topics and try to come up with a little phrase around that topic.
Yes, it's so interesting.
And as Dawn is talking right now, CEO speech has helped Dawn a lot. If you think about the way a CEO communicates, what we're doing is you're essentially making every word sound very intentional. And when you use intentional speech, what's happening is you're opening your mouth wider, and that's giving your tongue more room and your jaw more opening to make those clearer speech sounds. It's breaking up multiple syllable words into smaller bits and pieces. If I'm speaking like a CEO, what's happening is I'm breathing a little more deeply. All I'm doing is I'm just telling myself I gotta say words intentionally, but all of these other systems are changing as a result of it. So you don't have to do too much. Okay, I have to sit up straight. I have to open my jaw wide. I have to inflect my voice. I have to do all these things, which is too confusing.
Yes.
All we have to do is just say, let's talk like a CEO. Let's talk like JFK.
So that's what you're working on with Dawn.
Right. And that really helped with opening up the weaker side of the face as well.
It's so interesting because I know that feeling of, you know, if my wife's talking or somebody's talking and I want to say something, I know what I want to say, but they're busy talking to somebody else, then I forget. So, but I try real hard to remember what I was going to say, and then I have to say it. It's my turn to talk, and then I forget. Then I have to make up something else that I can't figure out what I was going to say.
That's really hard because you used to communicate just off the cuff. Things used to come to you and then you said that. But now all of this extra processing time is a little bit of a distractor for you. So you're constantly having to overanalyze everything and how to communicate it. And that's a lot to think about. And minimizing those environmental distractions is going to be important. You don't want those filtering in along with all of this extra processing you have to do, right?
Yeah, exactly. I mean, I always say a stroke is not for the weak. And I see Tommy, you know, I feel that when I do pause, it works much better.
Right. So we have this kind of little acronym. It's to pause, to plan, and then you can execute what you are planning to do. But then after you execute, you're going to have to kind of review what you just said and then revise it if necessary. To go through this whole like kind of systematic planning and troubleshooting approach can be a very good way of successfully communicating with someone. So it's plan first, and that 5, 10, 15 seconds of planning would be you creating like a map of your ideas, even the keywords, even if it's like little emoji pictures coming up in your head. And then you somehow create little sentences connecting those emoji ideas in your head, and then you go and execute that. And you have to kind of review, did that come out the way I had planned? If not, that's okay. We're going to try to see if we can revise it as much as we can. But that caregiver, whoever we're speaking to, also needs to be in charge of this successful communication exchange too, right?
Right.
So that person who we're communicating with, oftentimes they may know that person before the stroke. They may have these expectations, that are here.
Right.
So that person may want to speak for the person who has aphasia. That person might want to just jump in and respond for them. That person might not be able to be okay with speech productions that are not up to that level. And that becomes really hard for the person with aphasia, so much so that they may not want to communicate as much. Right. They may kind of shut down. They may become more reliant on that caregiver to just talk for them. But if we can just try our best to have that caregiver kind of take that little bit of a step back, still supporting as needed, but the person with aphasia trying their best to do that plan, execute, repair strategy as much as we can.
So is it okay to, when you're talking to somebody with aphasia, don't finish their sentence? Is that right?
It's kind of like person specific, right? Because a person might really like that. They might really enjoy having someone step in for them and just fill it in, because then, the frustration is less with communicating. But we may not be able to rebuild language in that way. Our goal after aphasia is to rebuild our network of language and be able to memorize what we did and how we did it successfully. And the only way to do that is if we do it ourselves.
Right, right.
That's a hard place to be in for a caregiver, because you want to help the person, you want to help them be successful, but at the same time, you want to help them rebuild their language back up. Okay. Really, the only way you can do that is if that person with aphasia tries.
Yeah, okay, yeah, because I had somebody on the show, husband and wife, and she was a professor at Stanford, and she had the stroke, and she had aphasia, and her husband never interrupted her. And she finally unless she couldn't find that word, then he helped her. Right. But that's the only reason I asked that. So Teresa, yeah, she's another friend out there. So did you see her comment there? Her long comment, Teresa.
Recovery challenging. I can now laugh. Years ago, I just cried. You're a wonderful teacher. Oh, that's really great. Yeah. Okay. So we're talking about a little bit of memory here too. Okay. So we're trying to encourage that person with aphasia to be able to be as independent with communication as they possibly can, right?
Right. Yeah.
So we have to kind of think about this like you're a student again, almost.
Yeah.
Think about how a student thrives in the classroom and how they thrive on a quiz. They study. They have to do the work. They have to read. They're going to have to be the ones to write it out because of that. Not that muscles have memory, but we have the memory of writing, right? You're going to have to be the one to rehearse it. You have to be the one to review it. No one else is going to do that for you. And if they do, you're not going to learn very well. So it's kind of like putting yourself back in that place of how a student would learn. You have things that help support your memory.
Okay, so as a speech-language pathologist, what steps can we take to improve our communication skills?
Ooh, that's a loaded question, right?
Well, yeah, because there's tools out there, isn't there? What kind of a tool? It's a electronic tool, or there's some kind of thing you can use with that.
Yeah, there's technology. I think that even the best of technology is not going to replace a speech pathologist. Number one is to go ask for a speech pathology referral. That would be number one. The other thing that I would encourage you to do is, there are some really nice apps out there that can help like flashcard type of apps that are free. You can look up flashcards for fruits, vegetables. There's all sorts of free apps out there. Just go onto the App Store and look for flashcards, picture flashcards. And you're kind of just going through and seeing if you can name them. There's a really nice app out there for apraxia of speech where someone has trouble getting the motor planning. They have the concept of what the word is, sending the information to the mouth. The mouth is not doing what it's supposed to. So the plan is kind of broken down. There's a really nice app for working on apraxia that I really like, and it's called Speech Sounds on Cue. Speech Sounds on Cue, very low cost app. These low cost apps are the ones you want to be looking for at first, because you might outgrow them and then you don't want to be having to pay these $300 apps. There are high-tech apps that help communicate for you. So that's called augmentative alternative communication or speech generating devices. Those apps are high cost. There are specific design devices that can help you communicate using computers to communicate for you. We obviously depends on what the speech pathologist recommends for you. Like that lovely person had mentioned, like reading helps. Yes, reading for sure helps. Read out loud. A little bit of singing might do a body good. Singing and melody. Well, it may not have, amazing transference to communication. It can help get somebody talking who's not speaking. So you might see a speech pathologist in a stroke unit singing with a patient. You're wondering what's happening here. Sometimes that melody is stored in an area of the brain that is untouched by the stroke. And while someone is unable to verbally communicate a message, they may be able to sing. They may be able to count. They may be able to say sequences of words that they've known for their whole life.
Right.
1, 2, 3, and then we can turn that into speech. 1 apple, 2 bananas. They may be able to say the months of the year, the alphabet perhaps, and then you kind of mold it and shift it into more functional communication.
Yeah, that's good.
Yeah, so automatic speech. Trying to think of other just simple ideas. Reminiscing through photographs is a wonderful way of helping with rebuilding functional communication.
Right.
If you look at photographs of your travels, right, you can talk about so many different things. Who is this? Let's see if we can repeat their name. Can you look at how I'm saying their name and try to repeat it after me? This is Sharon. Sharon. Sharon is your cousin. Sharon is who? Sharon is your cousin. There's repetition that can come from that. There's memory that can come from that. You could talk about where you were on that vacation. Reminiscing through old photographs, right? Pretty simple stuff. And you don't have to get any kind of app for that. Just bring out old photos.
Wow.
There's let me think. Functional script training is something that I like to do at first with people because it helps them gain a little bit of confidence. And when you can get a little bit of confidence, then it really makes a huge difference with your relationship with that patient and their quality of life. So functional script training is where you take a scenario that you come across every day. It could be checking in for appointments. And as the speech pathologist, we help guide creating a script. It could be like an actor reading off a script, right?
Right.
My name is Lindsey. I'm here for my speech appointment, and my appointment is at 9 o'clock. Real simple, written out really big and bold, and you can rehearse it, just like an actor, and see if you can use those lines of the script when it comes time to use it. There's a really nice website that's free and you can join for free that is essentially kind of like script training, but it's more scenario based, and it's called ScenariAid, kind of like scenario spelled, but it's ScenariAid, and I can use that information to post on your website. But you could go to Google and just type in ScenariAid and go in for your free login account. And when you go in there, there's going to be scenarios that you can practice. Ordering it Subway is one of them, ordering at McDonald's. And they're real life scenarios, like somebody will come up and say, how can I help you today? And it'll pause and you have to respond. And it's kind of like real life scenario practice.
Yeah, that Tommy's saying here, what about the memory?
Stressful. Okay. So I see Tommy is asking, what about the memory and knowing the word, but you can't remember how to use it or how to pronounce it? It happens to me when he's on a show in a more stressful position or with anxiety, right? He's in 2-year recovery. Word finding is a very tricky thing to work on because it's really hard to predict what word you're going to have trouble finding. So what we try to do is, what I like to do are little timed word games where you can take a category or even a subcategory. You give yourself a minute on the clock. Let's see if we can name 10 or more within that category. And the categories you choose are important too. If animals are not important for you, we're not going to be choosing animals as your category for practice. We may be choosing whatever category of words you feel like is important for you. There are like little journals I have people start for word finding.
Right.
So a word that is constantly coming up, like, oh, I can't remember that word. Put it in a journal. Let's put it in a diary. And
Right.
we're going to work with that word in your diary. We're going to practice it. We're going to repeat, repeat, repeat. We're going to write it down. We're going to use that word in a sentence every single day on purpose. We're going to write down a sentence using a nice, elaborate wording and using that word within a sentence. And let's rehearse that. So like a student would do, we can't just use it once and then expect it to be in our memory forever, right?
Right, right.
A student would do that. They would cram and then it would get thrown in the trash the second they leave the classroom. Like, I aced the test, I'm done, peace out.
Yeah.
No, we have to review. And so you're gonna, again, be putting yourself in the position of a student. You can put that on a flashcard and see if you can just randomly throughout the day quiz yourself.
Right.
Basic memory tools I've put into like an acronym to help you remember how to remember.
Yeah, yeah.
So my acronym is WRAP, like wrap it up or rapid present.
Right.
W stands for write it down. The R stands for repeat, repeat, repeat. We're not just going to be repeating once. A student has to repeat something 3, 4, 5 times over a period of time to remember. The A in RAP stands for make an association. Create some little keywords around that word to rebuild your knowledge of what that word is. You're rebuilding kind of the file folder of where that word is held in your head.
Wow.
The P is to picture it. Create a visual, draw it out, whatever kind of visual you can create. Take a little mental photograph or a mental movie of what that word is or the group of words you're trying to remember. So WRAP, those are general short-term memory strategies, very general.
Right, right. Now I think I understand. Going back to the pictures, that my trips we went on, because when I had speech therapy, my wife, I don't know how, now I know she brought the pictures because the speech therapist probably asked her to bring pictures of familiar things that you did, and we went through just like you're saying.
Highly relevant personal information sparks something in people, right?
Yeah.
If we just go through with just some random flashcards we got at the 99-cent store, it's great, but personally relevant things are even better.
Yeah, okay. Yeah, that's so Melissa here, let's see. Melissa's a caregiver.
I think don't worry about not being able to sing. I feel like anyone can kind of hum a tune a little bit. And it just really depends. If that's not your forte, then singing is just not the way to go about things, because
Right.
like you said, if therapy doesn't feel like something that's super interesting, if it feels like, oh, I do not want to do this right now, then it's not going to work. Right,
right. There you go, Tommy. Thank you for Lindsey.
Tommy.
Yeah, there's so much out here. These comments, I don't know if you could probably see them. Okay, so salute.
Yes, exactly. Great. Yes, salute. Write it down, repetition, association, and picture it, right? And when we think about that RAP strategy and using that to help solidify new information, we have to make sure to review that information. So we use that RAP strategy to learn the information, and then we have to do something with it. The RAP strategy helps us pay attention to this new incoming information we want to hold. But then we have to do something else to hold it in here and to start encoding the information. So that's where spaced retrieval or delayed recall comes into play. So that's what I was talking about with the quizzes. So you have that on a flashcard. Periodically, you're going to quiz yourself on that information. The more and more you quiz yourself, the more that starts getting encoded into your memory storage.
Right. Okay. Interesting. Now, when I went to speech therapy, I used, not always, but I started out on a keyboard. I remember we talked earlier. Do we still use that in therapy?
Yeah.
To, find H or whatever.
Yeah.
Really?
I'll meet people who really enjoyed writing. That was like their thing. So we'll start with writing instead of, typing. If I'm working with like a business executive who, is typing all day for a living, yeah, we might do a little bit on typing. I think the occupational therapist really does get into the nitty gritty of like, okay, how does this person need to write? And we need to work on the hands for writing, and what kind of utensils do we need to write with? What kind of adaptations do we need? And then, after seeing the occupational therapist and me reading what they need, maybe typing will be a part of that. Typing requires a lot, right? So it's a lot of thinking involved. We have to coordinate the fingers to reach the keys. Sometimes people don't recognize letters anymore after a stroke. Sometimes it's not the letter recognition, but it's the sound recognition. You may say to yourself, yeah, I know that's an H, but I don't know what words start with an H, and I don't know the sound the H makes. So the speech pathologist will help kind of guide the therapy, and based on the assessment and based on the speech diagnosis of how to go about learning writing again. But typing is, a really nice way of starting, because a lot of people do have a way of typing and practicing that at home. But a lot more people have pen and paper.
Yeah, yeah.
Pen and paper is a really nice way of relearning information. Takes a little bit of, students who end up writing their notes in class end up doing a little bit better than students who end up typing notes in class. So it's this like memory of writing and the work that's gone into writing, okay, H, and then H starts with the ha sound. Okay, let me think if I can think of 5 words that start with the ha sound. Now let me see if I can locate that on the keyboard. So you're just building and building layers of your understanding of this letter H. That, going through life and learning language, you never really had to think about the little nitty gritty ways of like how you learned this information to be. It just kind of came to you through your experiences. And now you have to take a step back from all of what you know and relearn. And it can feel a little demeaning. Yeah,
that's how. That's so true. Because when I was talking to them, I feel like I'm glad you're not asking me like how many words start with, because I feel like how much I don't know anymore. I mean, as far as speech, just listening to you makes me think I need to go back to speech therapy, and I know my wife wants me to go, but like you said, the masks and all this, I don't want to step out of the house.
Right, it's hard. Video visits are sometimes an option depending on where you are and what system you're hooked up with. But yeah, it's hard. Going into a therapy session, it'll have to be your judgment. But I think that speech therapy and getting a speech therapist on your team to help devise a treatment plan that's right for you. Because yes, we could say that these are like general everyday activities that could be helpful. You may have a very specific speech diagnosis that needs something very specific, a certain treatment plan. And there's never like a one-size-fits-all treatment plan.
Right.
And that's very important to remember, not only for speech and voice, for everything. There's never really like a one-size-fits-all treatment plan. What sometimes makes me cringe is like people are going into the hospital after a stroke and they're told by somebody, just do a chin tuck and you can swallow better. If it were that easy, I'd be out of a job. So that's never a one-size-fits-all type of deal. Maybe
Yes.
that will help some people. Some people, this can make it worse. So you always want to get someone on your team that knows what they're doing to help you after a stroke.
Yeah, because I wonder, because I always say that, because I've interviewed a lot of stroke survivors too, every stroke is like a fingerprint. They're all different. Their stories are all different, little by little. And we all have the same, not outcome, but like usually weak on one side of the other. But for the most part, every stroke is different. And you find that, you were saying that earlier, similar to that.
Right. Yeah, every stroke is very different. There's a lot of brain and behavior correlations. If the part of the brain is impacted from a stroke, we might expect certain behaviors.
Right.
And certain deficits, right? But it's, you know, going through school and going through my first clinical work, it's like, where is that person with just straight up broca's aphasia that I read about in my textbook? It's really not ever the case where you have someone that is really straightforward like that. Very, very rare. So it's just like a comprehensive assessment is really necessary for each person, because we can't go into a situation and say, here's the referral, it says broca's aphasia, and know exactly what to do when that person comes into our room. They may present with so many different things that we didn't expect. Yeah,
it's so true, because I remember, like, my neurologist, I said, well, I need to go back to speech therapy. Okay, write a prescription. That's it. He didn't say, you know, so I had to go in and get evaluated, and then you guys would determine, you know, my diagnosis, what I need.
Yeah, exactly. So, and working together on kind of that team approach is really useful too. So if you have access to like a rehab type of unit, or where there's a physical therapist, OT, and speech pathologist kind of working together and communicating with each other, I think that's the best scenario. Not everyone has access to that kind of care. So yeah, a lot of people are kind of stuck with, how do we come up with therapies on our own?
Right.
I could definitely give you a few little resources you can put onto your website.
Okay, that would be terrific.
Yeah, I can, you know, even like in this room that I'm in, you can't see, there's, I mean, however many objects in this room that I could create probably endless amount of therapies around.
Really?
There's, I mean, trophies over here. Okay, simple, my husband has his running trophies over here. So what did you get those trophies for? This is a trophy. When did you get that trophy? Do you know how to spell the word trophy? Let's see if we can write it out.
I'm nervous.
Sports did you do when you were in high school? Let's see if we can name as many sports as you can think of that are out there. How about some major players in each of the sports that you really enjoy? Just from the word trophy, right? So there are so many. And trophy has irregular spelling in there too, so working on irregular spelling.
Right.
So just from that one object, right? So you get a little clever with your environment sometimes. If someone really enjoys cooking, that's a really awesome way to target so many things: attention, memory, calculations, sequencing. What do we do first, second, and third? Let's see if you can remember this recipe. If we have milk and butter, what's the third missing ingredient? Oh, eggs. Okay. Yeah, I mean, there's just so many everyday opportunities to just fit in a little bit of therapeutic activity.
Right. So, Dawn. Yeah.
Thank you, Don. I appreciate that.
Yeah. So, Dawn, when do you go back to therapy again? It's good he goes to speech therapy and there's no mask. Maybe you wear a mask, or because I think speech therapy, you'd have to have no mask.
I do video visits.
Oh, okay.
As a speech pathologist, yes, I do see people for swallow disorders, and I do assess swallowing. And during those moments, people are unmasked. I have my mask on. So yes, we are exposed. It's just kind of part of being one of those healthcare workers that is unfortunately in the line of duty. But we're in this for a reason, and that's to help people.
Yeah, I agree. I mean, it's amazing that, well, just I'm thinking of myself, I have been going to therapy 6 months a year consistently for the last 9.5 years. But speech, I recently, well, it seems like it's recently, but January 29th, I broke my hip. I fell, long story short, I broke my hip and they put me into inpatient therapy. And my wife said, you need to get speech therapy as well. And they did an assessment and I needed it, but I didn't go because I wanted to work on my hip. And 2 weeks into it, they got us, we all had to leave because of COVID. So, but I'm thinking back, I needed to go. I really do. Because when I give a speech somewhere, I kind of not freeze, but I mumble it all up and I start shaking. I've never had that issue.
I think that after a stroke, I mean, it's really hard because you're thrown into this position you've never been in before.
Right.
You know, you have to navigate uncharted territory, and it's like, you know, priorities is like, yeah, I need to walk again. Like, I can understand where you were at. I really can put myself in your shoes, and yeah, walking and your hip and like being able to use your hands again. I mean, they're all priorities. Speech can be a very frustrating rehab process. So
Yeah.
that can make somebody feel like a little bit like, oh, I don't want to go. I don't want to do this anymore. I feel defeated. But pushing through, finding ways to make it interesting and personally relevant can be very helpful. Having lots of group support around you can be very helpful. So even if there are no therapy sessions that you can get to, oftentimes there are community stroke survivor groups that we can find. And especially now where everything is kind of online and through Zoom, to look and do a really thorough Google search or ask your neurologist about support groups in the area.
Right,
that can be a great way of just trying to keep up with everything.
Yeah, because salute, thank you there. Thank you, Lindsey, for taking your time. Thank you. And thank you, Dawn. That's awesome. Appreciate that. What was I going to say? Here we go again. I feel so nervous with you because I don't, you know, it's funny about the.
You're doing a great job.
Oh, thank you. But it is funny about the speech. I really, and I feel guilty that I haven't gone. I mean, that's my own fault, but I need to go back to speech therapy. And okay, what I was going to say just came back is that we have a community of stroke survivors out here. And like we communicate. I know a lot of them here. Like Yvonne, she made a comment here. She's from Athens, Greece. I'm not sure what the time is there, Yvonne, but thanks for being here. Let's see. Start from scratch as a language. I don't know.
To start from, do you think it's more effective to start from scratch as a language, addressing from the point of reteaching?
I don't know.
That I guess it's again probably patient specific and kind of deficit specific in regards to that question. Yeah, I mean, if we're thinking about, okay, what are the deficits here? Where are the primary things that are happening here, and what do we need to relearn first in order to make big changes?
Right.
So, yeah, I think that yeah, that's a hard question to answer, and it does depend on the person.
Yeah, I agree. Everybody has their own individuality. Dawn, I'm happy that you say that, because I mean, if Barbara was in the same room, she'd probably shaking her head, my wife, saying, oh my gosh, you are just a mumbling idiot or something. But thank you though, I appreciate that. Yeah, so here, salute. So yeah, be determined, never give up.
Right. I think that's really great. So be determined, never give up. Putting together a list of your personal goals is very a good thing to do. So what I would say is, you know, not only like, let's come up with a reachable goal. Like, I want to be able to communicate with someone on the phone for 10 minutes without having trouble with word finding. Is it a reachable goal? And how long do you think it's going to take to reach that goal? And why is this goal important for you? And if we don't reach that goal, what are the downsides? Thinking about it that way. Like, if I don't work on this, what could be the outcome? And now flip it around, like, what is the benefit of working every day towards this goal? And thinking that way, kind of like this forward-focused way of looking at your goals. Always take a little bit of like a video of yourself every month. Just communicate and take a little video of yourself. And then you have these benchmarks for how far you've actually gotten, because sometimes you can't see it in yourself. Other people might see things in you that you don't see yourself. So have someone take a little video of you and watch back each month, do a new one. And then check in with your goals. How am I doing with reaching my goals? Am I not quite there yet? Do I need to do little baby steps? Yes, written lists for sure of your goals. That's what I would suggest.
Yeah. It's funny. I look back at these interviews and stuff, and I look and think, okay, where can I improve? Or I missed this. I should have said something different, or it's not coming out right. So I understand what you're saying, but I'll really look at them and evaluate myself, because you speak perfectly. That's right. Listen.
I still don't speak perfectly, and everyone has little moments in their speech. So someone is never really like this perfect speaker, and it's always a good thing to just kind of say like, hey, this is where I could improve. Everyone has this room for improvements in their life. And it doesn't matter what situation that person is in. There's always ways to strive to be a better person. And finding like, okay, I put it into words. This is how I think I can become a better version of myself. Now, how do I achieve that goal? And what's the downside if I don't work on meeting that goal? And what are the benefits of me working every day towards that goal? Right.
So yeah, I need to, I'm so glad that you're here, because I really have to improve, and I'm going to have to get into speech therapy. I mean, even if it is teletherapy, because it's like the same. I mean, It is the same.
With speech therapy, it's a wonderful ability, that we have through video visits right now, so that you can see us talking. We can work on repetition. We could work on your apraxia, and you could be able to see us. But, face-to-face conversation is also very wonderful. And it's hard to say that video visits are comparable, but I would say, get into speech therapy however which way you can.
Right.
If you feel like that's an area you can improve on.
Well, yeah, I've always, the more and more I think about it over the last year or so, I don't know why I've hesitated, but I do need to go, because I need to improve in that. I've always worked on my hand, fine motor skills and the physical part of it, but I've kind of neglected the speech part of it, thinking, oh, I'm okay. It'll get better in time. But I've seen it's not. You have to work at it. At least for me, I think.
And I think you continuing to do these videos and bringing on guests and speaking publicly is a really wonderful therapy you're giving to yourself. So I just encourage you. You're doing a great job.
Well, I'll have to get Don. I have to talk to Don more, because he's so proud of you. I mean, watch this thing. So yeah. But but what, I mean, I know it's been close to an hour. I mean, time flies. So what else could you kind of tell anybody that's struggling with because there's how many types of speech, like what do you call it, aphasia? How many types of aphasia? There's got to be many. Yeah,
there's multiple different types. The most common types are Wernicke's aphasia and Broca's aphasia. Wernicke or non-fluent aphasia and fluent aphasia. Those are the most common ones we see. So fluent aphasia is where somebody has a lot of speech still coming out, but the speech may be nonsensical. Yeah. They may have no idea that what they're saying actually doesn't quite make sense to somebody else. They may be repeating the same type of words over and over again. They may be coming up with completely made up, strange words that you've never heard before. They may not be able to say their own name, but they're sure they're saying their name.
Right.
Their speech is fluent, but it may be nonsensical. They may be unable to repeat after your model, and they may have trouble with comprehension. So that's a common type of aphasia we see that, that's a harder type of aphasia to treat. I would say no matter what kind of aphasia or some kind of challenge or a deficit someone has, for a caregiver and for the people surrounding that person, don't talk down to the person with aphasia. This is still the same person. This is still the same intelligent being. What's happened is something in the language centers of their brain that's making it hard for them to communicate. So let's not talk down to that person. We're going to treat them as the adult that they are, but we may form our words a little bit differently.
Right.
Broca's aphasia is that non-fluent aphasia. Broca's aphasia is where you have the conceptual knowledge of words, perhaps, or you may have you kind of lost the ability to communicate the words that you want. But overall, like some of the framework is still there, but the words just are not coming to you. And some of the pauses and hesitations in your speech are very interruptive to the flow of communication.
Wow.
That person may be better able to repeat, and that person is able to comprehend a little bit better, but still, difficult to treat, but is treatable.
That's great. So any final since we're down near the end of the show, any last parting words that you can tell everybody out there?
I would say to never give up. Always find new and different ways to communicate if the verbal message is not coming easily. We have the ability to do different things with our body to communicate, right? We have facial expression, and we have intonation patterns, and we have body language, and we have the ability sometimes to draw. So I would say if communication is difficult, go at communication a little differently than how you normally think of it, and try your best to use a multimodality approach to communication. To find a way to get in to see a speech pathologist so that you can get that caregiver training, so the caregiver knows how to communicate with you better, and to help you strive to get that language back, because it is on the caregiver as well to help kind of guide communication, to help that person gain communication back, and to provide that therapy at home, because the speech therapist is only with you for 45 minutes, maybe once or twice a week. It's not enough to make the changes you want. So that caregiver training component is very important. And to make your goals very clear, make them meetable, create little benchmarks for yourself, and to keep working every day at it and never giving up.
I appreciate that so much. Trying to get the last few comments, because they'll keep coming if I don't. But thank you, Dawn, for showing up here. I appreciate it. And but up there's a good buddy, Paul Cummings from Florida, and he speaks a lot on. If you ever have a chance, he every morning he does a show, Morning Coffee with Paul, and he talks all the time about aphasia. But anyway, if I can give you all the lists of all the all the shows that we do, so you can maybe keep track and check them out, because we have a big, large community of stroke and non-stroke, stroke survivors and their caregivers.
Right. Paul, I have seen your show. I think it's wonderful. Let me know if you ever want to connect and just talk, and anything I can do to help. You're welcome to contact me at any time if there's a specific question I can answer for you. I'm very happy to. I can provide you with that email address after we're done talking.
That'd be perfect. That'd be awesome. And before, one other thing is what Stephen's saying. I could be watching the show and start crying. Is that PBA or something? they call that, or something?
Yeah, I mean, that's kind of that diagnosis, and sometimes people are just emotionally labile after a stroke for many different reasons. There's so many chemical changes happening in the body. So yeah. Things can happen.
There is from Teresa, to you, Lindsey.
Well, thank you. Thanks, Teresa. I appreciate that.
Yes, and okay, so good. Okay, so you've seen Paul.
I have.
Yeah, good. Well, then I'll give you his, or you probably know it. It's his email address. I can get that, or he can, or you can reach out to him. And then, but you can stay right on, and I'll just say, you guys, thanks for being here, and we will